Today's topic, a parent's guide to understanding self-harm and supporting your teen. My name is Emily Bell. I am a licensed marriage and family therapist, an LMFT at Evolve Adolescent Behavioral Health. I have been with Evolve for over 5 years now, serving mostly in the residential treatment setting, though I have provided support for our outpatient programs as well. Evolve Treatment Centers is an adolescent treatment program that provides a few different levels of care all over California, and we treat many clients that deal with some of the struggles that we'll talk about today. So what will we talk about today? Ultimately, my goal here is to equip you with knowledge, tools, and resources to support your family. We will define what self-harm is and discuss the prevalence of it. We'll discuss common methods and functions of self-harm. I'll provide some practical tips for talking about self-harm with your teen. We'll outline when to seek professional help and what types of professional help is out there. And then lastly, we'll identify some interventions to help your teen at home, including safety planning and teaching healthier coping strategies. Before we dive all the way in, I want to start off discussing broadly about some of today's mental health concerns. It's important to mention that these statistics on the next two slides are averages. Most, if not all, these statistics are actually more worrisome for girls than for boys, so keeping that in mind as well. As many of you know, today's mental health concerns are quickly growing as a topic of concern for parents, and leaves many parents feeling, lost, overwhelmed, and hopeless themselves about how to support their children. The CDC has compiled a lot of really great research on teen experience and behaviors, which you can find by searching the CDC Youth Risk Behavior Survey, or the YRBS Explorer. The statistics here I thought would be most helpful for our discussion today, but the YRBS Explorer has a ton of information that is really helpful. So the percentage of high school students who strongly agree that they feel close to people at their school has declined from 61.5% in 2021 to only 55.3% in 2023. Dropping 6% in only 2 years is concerning. 19.2% report having been bullied on school property even, and 16.3% they say that they've been bullied online. So only half of high school students report feeling close to someone at school, and 1/5 experience bullying at school. So you can imagine then that going to school might be a tough experience for many teens. And then 23.2% of students say they get at least 8 hours of sleep on an average school night. We'll talk more about sleep later, but I'm sure many of you have seen firsthand, or at least guessed, how poor sleep and sleep routines impact your child's behavior. These next statistics are even more heartbreaking. 39.7% of students report they feel sad or hopeless. And the way they define feeling sad or hopeless for this survey was almost every day for 2 or more weeks in a row, so much so that they stopped doing some usual activities. Over a quarter of students describe their mental health as most of the time or always not good. And one out of 5 high school students report they've seriously considered attempting suicide. Approximately 65% of youth who do self-harm also experience suicidal thoughts at some point. Now, while that number is, of course, upsetting, I do think that it highlights, while those two mental health concerns, self-harm and suicidal ideation, are correlated, many who engage in self-harm do not want to die. So we'll look at that more closely in just a moment. And then one positive trend that the CDC reports that I haven't included here is that illicit drug use is actually significantly down from 26.5% in 2001 to 9.9% in 2023. So down quite a bit to just under 10%. So what exactly is self-harm, or what counts as self-harm? Commonly accepted and used definition is that self-harm is the deliberate act of causing injury without suicidal intent or for purposes not culturally sanctioned. Intentional injury that would be culturally sanctioned are behaviors like tattooing, piercings, or cultural rituals like coming-of-age rituals that involve some sort of body modification. How common is self-harm in reality? Now, you will likely find a wide range of statistics on the internet. Several factors can affect the results of studies on this topic, including the definition of self-harm that's used or how narrow or broad the population group is. The Journal of the American Academy of Child and Adolescent Psychiatry published their findings from a global meta-analysis on this topic and reported that 17% of teens endorsed engaging in self-harm at least once in their life. Statistics within the US exclusively are in line with this, are often reported to be between 10 and 20%. The average age of onset for these behaviors is 13 years old, and studies have found that behaviors typically peak at age 16. As previously mentioned, on trend with most mental health concerns, self-harm is more common among girls than boys. You can see here that among self-harmers, approximately 2/3 are girls and 1/3 are boys. And from the data we at Evolve have been collecting for several years through our internal outcomes program, we've determined that 82% of clients at Evolve report any history of self-harm in their lifetime. So this topic is one that we are very practiced in helping teens and their families manage and heal from. So after understanding the prevalence of self-harm, it's important to understand the risk factors. Having social connections who engage in self-harm may normalize this behavior in a teen's mind and increase the likelihood that they may experiment with this coping strategy. There's a term used in therapy and psychology called ACEs, which stands for Adverse Childhood Experiences, which are also risk factors. Listed here, we have, a history of abuse or neglect, life traumas, and unstable family environments. This could also include poverty, discrimination, or something like losing their home in a natural disaster, something traumatic. Difficulties with anxiety and depression are also correlated with higher rates of self-harm. What this might look like on the outside is patterns of self-criticism, difficulties with problem solving, or emotional sensitivity and reactivity. We'll go over some practical strategies to help with those a bit later on. And lastly, patterns of substance use is another risk factor for self-harm. So types and severity. We've defined what self-harm is, and we've discussed the prevalence and risk factors, but what behaviors are considered self-harm and what are the common methods of self-harm? What are the different types and the severity? The simple truth is that all methods of self-harm are cause for concern. If you know or suspect a teen you care about is using self-harm, the recommendation is to seek professional help. We'll touch on that as well later. And we'll look at the different types of professional help that are available and help you understand what level of care might be most appropriate for your teen. But all forms and severity of self-harm warrant professional help. These methods here are just 3 examples, certainly not a comprehensive list, but what I wanted to highlight is that it is less about comparing different methods of self-harm against each other as it is understanding each behavior on its own continuum, which may be a determining factor in the right level of care or professional help that your teen needs. So scratching with one's fingernails would be on a less severe end, while cutting that requires stitches on the more severe end. Hitting maybe the back of their head on a cushioned surface, like maybe the back of a couch when they're dysregulated, versus headbanging with force to their frontal lobe would be more severe. And as we can see here, there may even be behaviors that are not immediately recognizable as self-harm, such as plucking arm hairs on the less severe side. But just as substance use can escalate over time, self-harm behaviors can intensify without attention and help. For some people who self-harm, it is very much felt like to be an addiction. So self-harm behaviors can intensify over time for the self-harmer to receive the same sense of relief, just as someone builds up a tolerance to drug use. Other common methods of self-harm include burning, pinching, and hitting, but they may also look like less common methods such as starving oneself or misusing medication or substances. And then when we talk about the different types, research has shown that cutting and scratching is more common among girls and hitting is more common among boys. So let's look at a couple of myths and facts about self-harm. So the myth, only teens with suicidal intent self-harm. Fact, most self-harmers do not want to die. In fact, some report even using self-harm as a suicide prevention strategy. A myth. Self-harm is just for attention. The reality is that teens use self-harm for a variety of reasons, and it is oftentimes actually in secret. So if it isn't for attention and it is not with suicidal intent, what function does self-harm serve? Functions of self-harm. The Inventory of Statements About Self-Injury, or the ISAS, is a written clinical assessment that was developed to assist individuals with identifying the function that self-harm serves for them. At Evolve, we use a data-driven approach to guide treatment with your teen, and this tool helps us do that. Once we narrow down the function or functions the behavior may serve for a particular client, we are better able to help them practice strategies to get that need met in healthier ways. Each category has 3 statements that correspond to it, and someone completing the assessment rates how true each statement is for them. For example, when I self-harm, I am releasing emotional pressure that is built up inside of me, which corresponds to affect regulation. Or another example, when I self-harm, I am demonstrating that I am tough or strong. This would contribute to measuring the function of toughness. The most identified function in our setting is affect regulation, I think by far, which can be difficult for some parents or loved ones to understand. For those who report feeling more regulated after self-harming, they often report that they feel really intense emotions, maybe even overwhelming or completely consuming emotions. And after self-harming, they feel a sense of calm. So this may even release some powerful reinforcing hormones like dopamine and oxytocin. So it's important to have patience with your teen in recovery. These can be challenging things to move on from. At Evolve, I would say anecdotally that in no particular order, self-harm, anti-dissociation, anti-suicide, sensation-seeking, autonomy, and marking distress are other commonly seen functions amongst our teen clients. So let's talk a little bit about recognizing the possible signs of self-harm. There may be physical signs such as unexplained cuts, burns, bruises, or scars, or maybe unexplained tools, such as finding a loose razor in your child's belongings. There may be behavioral signs such as wearing long sleeves in warm weather or avoiding activities that show skin. And there may be emotional signs such as increased secrecy, social withdrawal, and emotional instability. And as we take a look at these, we can see that any one sign on its own may not be cause for concern. If a teenage girl is beginning to avoid activities that require wearing a bathing suit, that may not be because she's trying to hide self-harm marks or scars. And it's totally normal for teens to want a bit more privacy as they grow up. So that's normal teenage development. But taken with these other signs, they may be signaling something more concerning. Depending on your child's history with unexplained marks or bruises, those also may not be concerning to you. If your child bruises easily and they may not have an explanation for each one and may not have even registered when it occurred, that may not be of concern. I encourage you to use your gut. You are the expert on your own child, even if you don't feel like that's true anymore. And if you're worried about one or more of these signs in your teen, it's worth a conversation. How to actually approach the conversation. If you are scared or nervous, that is understandable. You care so much for your child and you want this to not just go smoothly, but you want to get the results without pushing them away. Over the next few slides, we'll review strategies for staying calm, expressing concern, what not to say even, how to build trust and connection. It's important to remember to avoid reacting with judgment or out of control emotions, and to use open-ended questions to demonstrate a desire to understand their emotions, not just ours. So managing your own reactions as a parent. If you're finding it difficult to stay calm about this, that makes sense. It's important to get your own emotions under control for the actual conversation with your teen, though. Even if your child reacts with intense emotions when the topic is brought up, remember to remain calm to not escalate the situation. Identifying some grounding or self-soothe strategies for yourself can be really helpful, or completing what is even called a cope ahead plan. What are some emotions I might feel when I have this conversation, like fear, frustration, or even anger? What unhelpful thoughts might I have in the moment? Like, is she trying to manipulate me? Or what urges I might have, like crying or raising my voice? If you identify these possibilities beforehand, you're better able to plan ahead for these emotions, thoughts, and urges to stay effective in the moment. And when you begin to have this conversation, first simply reflect what you've noticed or seen, like marks on their arms or the other warning signs you're worried about. And ask your teen in a non-judgmental tone, can you tell me about these? We would encourage an observe and describe approach, observing, noticing, and then describing non-judgmentally your observations. During these conversations, remember that you are the adult and to act as a role model for how to talk about scary things with someone that you care about and trust. If needed, it may be important for you to seek your own support with an individual therapist. Having your own outlet to maybe let out these, messy feelings might be critical for you to show up more regulated when it matters most. So what are some things not to say? We would recommend avoid asking why questions, like, why are you doing this to yourself? As tempting as this might be, a question like this might be felt by your child as an immediate judgment rather than curiosity. They also may feel pressure to have an answer when they don't know the answer themselves, which can increase feelings of shame. We would also suggest not to accuse or suggest that the self-harm is just for attention. As we saw earlier, there are so many other possible functions of self-harm, and they may actually be wishing very deeply that no one finds out. Even for those who do not make much of an effort to hide their self-harm, suggesting that the behavior is just for attention may lead to your teen feeling like you don't understand them or that you assume judgments about them. And then lastly, I would say try not to oversimplify your child stopping their self-harm. This can be a highly addictive behavior that may in fact be quite difficult for them to stop. Teens are already struggling with, intense emotions, learning how to navigate impulses, improving their decision-making, and their values as a teenager may not be the values you hope for them to have as an adult. They may really value immediate gratification. That may be really important to them. They may say that they don't mind the scars. All of these examples may feel invalidating to your teen. So we'll go over validation on the next couple of slides. But I do want to add, on the other side of the spectrum from these conversation mistakes, let's say your child's self-harm behaviors are a known fact between you. It's important to avoid unintentionally reinforcing the behavior by responding with highly desirable caretaking behaviors as well, if those behaviors are not given at other times. So if your child receives lots of cuddles and one-on-one time with mom after episodes of self-harm, and they don't receive that attention at other times, we may actually be reinforcing the behavior. So what is validation? Broadly speaking, validation is communicating to your teen that their experience and emotional response makes sense, given the circumstances. Validation is actively accepting your teen in the moment, not communicating an expectation or desire for them to be different. They only have the tools and knowledge of a teen, not the wisdom of an adult. And validation is taking your teen's experiences and responses seriously without dismissing or trivializing them. To build trust and connection, your teen needs to feel like you are interested in understanding them, not just interested in setting rules or expectations. And why is validation important? Well, it helps us build and maintain relationships. It also takes away the pressure to focus on who is right and helps you regulate yourself and your teen. If you are actively looking for the emotion or experience to validate, you're not focusing on what makes you feel terrified or angry, and you're better able to stay calm. And invalidation is painful, simply put. It can increase feelings of being misunderstood, judged, or even defective, like, what's wrong with me? There must be something wrong with me. Some key ways to practice validating is to fully and actively listen, reflect back what you're hearing, and demonstrate that you care about understanding them correctly. Reading between the lines, we sometimes, call this mind reading, or maybe, naming an emotion that they haven't explicitly said. That can help them feel understood and like, yes, you do get it. Validation is acknowledging how the experience makes sense, and being genuine. Being your authentic self tells your teen that you want a genuine connection. Building trust and connection. The basis for connection is going to be built on being in this with them. So tell them that they are not alone and reassure them that you are here to help them. One of my favorite reminders to parents or anyone really is that we can validate feelings without validating behaviors. What does that mean? Hypothetically, if you have a ninth grader who struggles academically, this may look like saying, I know you've been feeling overwhelmed with school lately. I know transitioning to high school can feel like a lot. So we've normalized the emotion of feeling overwhelmed with big and challenging change, while leaving room for follow-ups with, what are some other ways we can handle that emotion? We haven't validated the behavior. Another example could be, I would be really sad and feel lonely too if one of my best friends moved away. So we validated the emotion without validating the behavior. And what do we do if our child is resistant or avoidant towards the conversation? Maybe denies the behavior, blames you or someone else, or becomes emotionally dysregulated when you try to bring the topic up. Ultimately, please remember to be patient. This may bring up feelings of intense shame, fear, or even irritation in your teen at first. So they may not feel ready to open up. They may feel afraid or nervous to be honest right away. When to seek professional help. So we've talked about recognizing the signs for self-harm and how to approach the conversation with your teen. But a critical question is going to be, what level of care is the most appropriate for my child's behaviors? Remember, if your teen is self-harming in any form, it's recommended to seek professional help. So while the practices we've talked about so far are very helpful, I want to stress that you don't need to feel like you need to do this alone. Depending on the frequency, type, maybe severity, or other factors, a therapist or admissions counselor would be able to assist you with identifying the right level of care for your child. If the self-harm is frequent, severe, or escalating, your teen may need a higher level of care. If your teen is using suicidal communication or making suicidal gestures, this would also be a higher cause for concern. Residential treatment may be needed, or even inpatient hospitalization during episodes of more acute behaviors. And if your teen is unable to find or reliably use alternative coping strategies, the comprehensive system of support that they receive in programs like residential treatment or partial hospitalization may be crucial to helping them break the cycle of self-harm by having therapeutic support exactly when they need it the most. So the different types of professional help. Therapeutic support would be included in the outpatient therapy, of course, intensive outpatient programs or IOPs, partial hospitalization programs or PHPs, and residential treatment centers or RTCs. Not included there is inpatient treatment, which is generally considered a stabilization unit for the most acute situations, but they don't offer therapy. Their main purpose is going to be provide containment to protect against dangerous behaviors. So you can find evidence-based modalities being used at tons of RTCs, PHP, IOPs, and outpatient. The recommended treatment modalities for self-harm are going to be that CBT and DBT, cognitive behavioral therapy, and dialectical behavioral therapy. School counselors. So school counselors are well positioned to provide in-the-moment support when issues of academics or peer dynamics at school are your teen's primary triggers for self-harm. Psychiatrists may have medication recommendations to treat underlying problems like depression and anxiety. It would be important to talk directly to your child's doctor about what makes sense for your teen. And lastly, support groups. Not only groups for your child, but also support groups for yourself as well. Parent support groups can be really helpful to feel connected with others who are navigating similar struggles. Evolve provides a parent support group for parents each Thursday morning at 10 a.m. Pacific. So if that's of interest to you, please visit the Evolve website for more information and to register. I've personally hosted that before, and it's a really wonderful resource for parents. So we've talked about having the conversation and when to seek professional help or what types of help are out there. pretty much at all levels of care, one of the key parts of recovery for self-harm is going to be safety planning. So at all levels of care, you will find a therapist motivated to help your child do this. So an important step is going to be developing this, possibly, for a school environment, for your home environment, and then involve you as well to maintain that safe environment for recovery. So the key elements of a safety plan include, first, restricting access to self-harm tools, especially during the early stages of recovery. These could be knives, scissors, shaving razors, pencil sharpeners, which would include actually makeup pencil sharpeners. We've had clients report that that was their most common tool, and perhaps lighters as well. One thing that you may find is that when a preferred tool is removed or restricted, your teen may actually resort to, maybe some creative alternatives. Others could include maybe pencil erasers. This can be a method or a tool for self-harm. Or they might use a method of self-harm that they previously hadn't. So a safety plan should be seen as a living document that needs to be adjusted as needed. So additional elements of an effective safety plan are identifying the warning signs and your child's triggers. I would say with the warning signs, when I say early warning signs, I don't mean they aren't getting out of bed and they're refusing to go to school. I mean way earlier than that. Maybe it is helping your child increase awareness of signs like not feeling like they want to go to the grocery store with mom when they usually do, or wanting to sleep in and skip breakfast, right? These smaller and maybe more easily missed signs, identifying those early on so that we can address them sooner. Identifying early coping strategies, which we'll go over shortly, as well as trusted individuals. And an important part is to remember that may not be mom and dad right away. That's okay, as long as they are reaching out to someone that you trust. Having an understood contingency management plan, such as when to go to the hospital or what consequences may be followed through on, that all helps create clear expectations. And a good safety plan will also have rewards for recovery. After 30 days of recovery, what does your child want to earn? What about 60 days or 6 months or a year? That is going to help them feel not only supported, motivated, but that you are on their side. So just as important to understanding the importance of goals for recovery, I also want to talk about relapse as well. So understanding relapse. As I've shared so far, some people who engage in self-harm report or describe the behavior as an addiction. So slips may occur. If or when they do, avoid expressing frustration or using punishment. Remember the effective communication skills for building trust and connection by reaffirming your support and belief in them. Implement consequences non-judgmentally. What I mean by that is not saying to your teen after discovering a relapse, well, that was stupid. You can't go to the dance you wanted to this weekend anymore, right? If your child becomes angry or says that the consequences of relapse are punishments, gently remind them that these return to previous rules or consequences are really a system of support. Maybe that means restrictions on their social activity, returning to previous levels of restriction for self-harm, possible sharps around the house, relocking the knives away, having them ask for a razor before shaving their legs, things like that. Reminding them that these are a system of support to help them reach recovery again. And handling emergencies. So let's say you are made aware of a self-harm episode in the moment rather than discovering it after the fact. What makes the situation an emergency versus something to follow up with a therapist about? If your child needs medical attention for their wound, including possible assessment for a concussion after headbanging, or if their behavior is coupled with suicidal statements, go to your nearest emergency room or call 911. If you can fully and effectively tend to the wounds at home, provide this care neutrally and without judgment or an overly caretaking and tender affect. While caretaking and tenderness is, of course, helpful in building connection, Remember, we want to avoid reinforcing the behavior by providing this connection in response to the behavior that you want to decrease. So perhaps spreading that out over time a little bit and tending to the wounds with a little bit more neutrality. So perception versus reality on recovery. With slips that may occur, recovery will likely look more like the graphic on the right than the one on the left. Just because you seek professional treatment doesn't mean everything will continue to improve continuously. So this can feel like a long process. It can feel scary. It can feel really hard. But what does recovery really look like? How do we know that we are actually moving towards recovery? I would say small progress is still progress. So recovery looks like self-harming becoming less frequent and less severe. It may not stop all at once. Some kids who might find this more addictive because of those internal reinforcers might find this really challenging. If your teen is using healthier coping skills more often, if they're increasing honesty with you or their therapist, doesn't have to be with you, and working towards better communication, these are all steps in the right direction. So now, as you're navigating this non-linear recovery, what are some strategies to help provide ongoing support for your teen at home? What is your job in all of this, and how can you actually support them? Providing ongoing support for your teen. So reflecting back on what we've discussed so far, we've talked about how to approach the topic and promote a judgment-free space. And we've talked about encouraging and modeling open and validating communication. Now we'll look at healthier coping strategies and how you can be a part of that with your teen. We have 3 different little categories here, and your teen may gravitate towards 1 or 2 of these, but it's important to encourage and support them in exploring all of them before giving up or feeling defeated like nothing works. We have some mindful breathing and grounding strategies. These can help with allowing the urge to pass without acting on it. But it may take a lot of practice to tolerate sitting with the urge in the moment. So that may be challenging for some client or for some teens. I would say distraction techniques are some of the most commonly used strategies in the early stages of recovery with our clients. These could include physical activity, like playing a sport or even just going for a walk, taking the dog for a walk, a creative expression like art or writing, or music and entertainment. As we saw earlier, most self-harmers do so in secret, so encouraging social time with some positive influences to avoid isolation may be an important element for your teen as well. And while you may not always be, your teen may not always feel positively thrilled to talk about their self-harm urges with you, offering your company with no strings attached or expectations that there be some deep conversation in the moment may actually help your teen feel more supported. So I've had some families come up with maybe a code word, for instance, that the kid can use to communicate to their parents that they need company and accountability, but don't feel ready to talk about their thoughts and feelings yet. The impact of sleep, nutrition, and exercise. So poor sleep loss, both of these impair executive and cognitive functioning, which negatively impacts problem solving, impulse control, and decision making. This may contribute to your child feeling overwhelmed with day-to-day pressures, feeling inadequate in being able to manage those emotions. What is the right amount of sleep? Studies typically say for teenagers, 8 to 9 hours of sleep each night. I know this can be challenging for parents to really maintain effective boundaries on and communicate an expectation that they get this right amount of sleep each night. It's not easy. Teens notoriously like to stay up late, sleep in late. It can be tough. So nutrition, hunger, discomfort from overeating, and caffeine can all be significant vulnerability factors for poor decision making. I think, let's be honest, we've all been there and know this to be true. And then lastly, regular exercise contributes to better emotion regulation. All 3 of these affect what we call our window of tolerance. So the window of tolerance is this optimal range of, physiological and emotional arousal in which a person can function effectively. So what we're able to shrug off and let go on one day may trigger us to react harshly or impulsively on a day after you've only slept for 4.5 hours and maybe didn't have time for breakfast before rushing off to work or school for your teen. So self-harm and social media. We've come to a topic I know that some of you expressed some interest in prior to this presentation by submitting questions when you registered. Self-harm and social media is, I think really pertinent these days. Social media just alone is a very common concern for parents. So, and cell phones in general. And it's challenging to navigate this with today's teens. There's a lot of pressure for teens to be online. So, while cell phone use and social media could be a presentation all on its own, I'll try to just focus on its relationship with self-harm. 95% of high school students, high school age teens, report using at least one social media platform. And in today's world, teens feel a lot of pressure to be online, to have those social media platforms, to stay connected with their peers. They may feel that it makes them different or weird to not be, right? And then approximately 20% of teens report almost constant use. That's quite a lot. I'm sure many of you have worried about this already, might have a teen who is chronically online, and that's a struggle in the family. So there are some benefits to social media, and it's important to remember that, because if we ignore those, we're also ignoring your child's, the child's experience. So they do seek connection and support online, and they may encounter people who they feel like they can relate to. So it will, reduce feelings of loneliness in the short term. The consequences of social media are becoming more and more known, obviously, with research about, but specifically related to self-harm. Studies have shown that kids are sometimes exposed to methods or pro-self-harm media and individuals who may not be trying to reach recovery. And then more time online correlates with greater psychological distress overall. So this will increase the amount, the number and severity of these unwanted emotions that your teen has to learn how to manage. Healthy phone habits the specifics might depend on your child. But they might include, using app limits or other parental settings. So limits the time spent on the phone or particular websites that can't be accessed. It could also mean placing the phone in a locked space or at a certain time each night to reduce the temptation to stay awake and negatively impact their sleep. A therapy professional can help you and your family navigate, like, what does this look like for your family, and also help navigate resistance that you may get from your teen around putting healthier phone rules in the house. So raising emotionally resilient teens. Finally, I want to end with kind of an overarching goal. When we focus on raising emotionally resilient teens, we take the time to help them break down challenges and learn problem solving. We talk about how anxiety and depression are correlated with self-harm. So how can we reduce the depression and anxiety, right? Helping them actually learn problem solving skills and break down challenges. We will model and encourage openness to change and being adaptable. Adaptability is highly correlated with a sense of calm and being able to move through and be able to do that problem solving. So being adaptable is really important, and openness to change. When we're really rigid and closed off to change, any change in life can feel scary and increase our levels of distress. We normalize talking about emotions to decrease possible shame and help them feel comfortable with themselves and their emotions. And then we cultivate their interest to strengthen their self-identity. So is your child interested in music or some sort of crafty activity or some sport? Getting them into anything that they're interested in, trying our best to encourage that and cultivate their interests is going to help them feel more secure in themselves and decrease, as we said, those feelings of depression and anxiety. I want to highlight the resources that I've listed here. If you aren't aware, 988 is an active nationwide suicide and crisis hotline. Calling 988 will connect you with a dedicated mental health professional instead of calling 911 and being connected with law enforcement. So it is often seen as a very valuable resource for that. I've also included here the CDC Youth Risk Behavior Survey that I mentioned earlier in this presentation. The YRBS Explorer is a very user-friendly website. You can poke around and see statistics on a wide variety of youth behavior and risk factors that go much further beyond the scope of today's discussion. And then lastly, Cornell University's self-injury and recovery resources. I really can't encourage you to visit this website enough. They have compiled such a fantastic list of resources and have it organized in a very clear and direct way. So there is a section, if you click the resources for parents and other caring adults tab, you'll find links to resources and recommendations from everything from what to expect in therapy, dealing with power struggles, and even includes some of the crossover topics that we received questions on that were outside of today's scope of discussion, such as like the relationship between self-harm and eating disorders. So I found the Cornell University's website to be quite beneficial and really informative, especially from a parent's perspective. So I really encourage you to look into that. Thank you so much for attending this workshop and showing up. I know that this topic can be scary and can come with a lot of emotion. So being here, asking questions, this is an important step, and I really appreciate that. Thank you so much.